Janice, and I'm going to be your nurse for today. May I have your name?
Navia.
Okay, and how old are you?
10.
Alrighty. Well, you're here for a respiratory assessment today, and it'll be short and simple. First, I'll listen. Well, I'll look at you and inspect you. So I'll look at your anterior and posterior, which is the front and back. I'm also going to palpate, so that'll be me touching with my hand, the ball of my hand or the ulnar inside of my hand. I'm going to percuss, where I'll be doing some tapping in certain areas, front and back. And I'm also going to auscultate, so I'm going to listen to your lung sounds front and back with my stethoscope. Do you have any questions for me?
No, ma'am.
Alright. So first I'm going to be looking at your anterior, your front, and your posterior. And I noticed that the anterior posterior to diameter is equal. So it's like 2 to 1. And I'm also noting that I don't see any abnormalities or no deformities, no forceful breathing. Posterior wise, your body and your spine is midline. Your scapula is even. It's not higher or lower. One, it's not like lopsided or anything like that, so that's normal. The scapula is symmetrical. I'm gonna palpate just to see if you have any tenderness, okay? So I'll palpate and start at the apex of the lung back here, and I'm just touching to see if you have any tenderness. Do you feel any tenderness there as
No.
I touched?
No, ma'am.
Okay. Alrighty. So now I'm going to do the tactile firmitis, which is me touching with the ulnar portion of my hand. I'm going to ask you to either say 99 or blue moon, so whichever you choose, okay? So as I touch, you can say the phrase.
Blue moon.
Okay.
Blue moon.
Okay.
Blue moon.
Okay.
Blue moon.
Alrighty. And I did feel vibrations, and vibrations were equal. I'm going to do the symmetrical expansion. So I'm going to put my hand right here. You'll feel me kind of push a little bit. And I want you to breathe out. And then I want you to breathe in. Alrighty. There you go. You can relax. And everything was normal and symmetrical there. I didn't notice any one side abnormally larger or anything, so both of those were even. Next I'm going to do the percussion. Okay, so I'll be percussing the posterior, but the apex of the lung. And when I percuss, this is mostly the lower lung. So this here is mostly the lower lung sounds. So here, this would be my apex. And I'm just doing some percussing and tapping to make sure that the sounds are like low pitch and hollow, because if they're not, then something is abnormal. It means that we might have some issues there. Okay, and so the percussion sounds, well, like I said, they were low pitch and hollow, which is normal. I didn't notice any abnormal sounds. So here I'm going to come to the front. I'm going to inspect the anterior portion of your chest or your lungs. And here I pretty much can hear the upper lung. So this is your left side. This is your right side. But your right side has 3 lobes, and then your left side has 2 lobes. So I'll be listening to the upper lobe and the right middle lobe. So let me just observe, and that is your your everything looks normal. I don't notice any abnormalities. I don't notice any forceful breathing or any use of accessory muscles as you breathe. Your color and everything is normal. I don't notice any blueness or any pale to where you're having oxygen or breathing problems. And your respirations, when I counted, were 20. So your respirations were 20, which is normal for your age. You're 10 and you were moving around and doing stuff right before we sat down. But everything is normal. I'm going to do my well, first let me do my palpate. So I'm going to touch you to see if you have any tenderness, okay? And just let me know. I'm going to touch here, which is a little bit above the clavicle, and let me know if you feel any tenderness. Any tenderness?
No, no.
Any tenderness?
No,
Any tenderness?
No,
Okay. And then I'm going to do my percussion, okay? No tenderness was noted when I did touch or palpate. So I'm going to do my percuss. Okay, and the sounds were low pitch and hollow, which was symmetrical and even on both sides. And I'm also going to do the tactile phrenitis. So I'm going to do like this. I want you to say blue moon or 99, either one.
Blue moon.
Okay.
Blue moon. Blue moon.
Okay. And the vibrations there were equal. I did do percuss, so next I'm going to auscultate. I'm going to listen to your lung fills, okay? And you just breathe normally. Once I kind of move each portion of the stethoscope, just take a couple of breaths. And this is kind of like the mid-axillary. And I'm listening to lung sounds. Okay. And the lung sounds anterior seems clear. So I didn't notice any abnormalities. So I'm done with the assessment. Do you have any questions?
No, ma'am.
All right. Thank you. Okay, giving a report on to the next oncoming nurse. We had a 10-year-old female come in for a respiratory assessment. Upon inspection, everything was normal. From the posterior, the spine was midline. The scapula was symmetrical. I didn't notice any abnormalities. I didn't notice anything misplaced. I didn't notice any forced breathing. Upon palpation, I didn't notice any tenderness. And upon the tactile phrenitis, everything was normal. The sounds were low pitched and hollow symmetrically. The symmetrical expansion was even. Both hands did like kind of separate up evenly. So no abnormalities there. Upon percussion, those sounds were hollow. The percussion, the sounds were hollow and low pitched. With the tactile phrenitis, the vibrations were even and symmetrical. Palpation, like I said, I did not notice any tenderness. Auscultation, the lung sounds were clear posteriorly, and the anterior posterior transverse diameter was 2 to 1. Upon looking at the interior portion of the lung sounds, they were upon inspection, they were normal. I didn't notice any abnormalities, nothing that was unilateral. Everything was equal. The clavicles were normal, no forceful breathing. Respiration was 20. And respirations were 20. The tactile firmitis was normal. I noticed equal vibrations as she was quoting Blue Moon, and the symmetrical expansion was normal, symmetrical. Upon palpation, I palpated with the ulnar portion of my hands. No pain was noted, no tenderness, and I also auscultated all lung fields, and the lung sounds were clear and equal. It went into a simple pattern, so it wasn't like a breath and then a pause. So it wasn't like Shane Stokes or anything. It was equal respirations. And that is all